we know AI is doing something. What is it doing exactly? So as far as reshaping healthcare discovery, so we're talking about searches, right? Online searches, people looking for medical providers, looking for clinics, looking for healthcare brands. So there's 5 things here up on the slide. The first thing is obvious. We're seeing new AI platforms on the rise. Patients, potential patients, using platforms that didn't even exist a few years ago. Search engine assistants like Google Gemini, Microsoft Bing Copilot, and large language models, what we call LLMs, that's ChatGPT and Perplexity. They're very, very commonly used now for healthcare searches. And the other thing we're seeing is generative answers. What these models do is instead of, when somebody does a search, instead of giving you just a simple list of website links, these models generate an answer of their own themselves. They're not literally copy and pasting something. So these are answers from their training data and from their pulling live information from the internet. The other thing we're seeing changing is queries and journeys. So many of these platforms, they have little microphones, right? So people can speak the search. So we're seeing longer queries, more complicated, detailed queries. So whereas in the past somebody might have just, looked for a certain specialist, now they may ask for, you know, can you give me a pain management specialist who takes Medicare, who does a certain kind of injection, who can treat my spine pain? So long, long queries. And then the other thing that we're seeing is that the patient journey from, initial search through to becoming a patient, those journeys are changing, and we call them a pinball machine now because there's so many different channels, and then there's all these AI platforms. So people might start in ChatGPT, and then if you show up in there, then they might go on Google and search for your brand and look for reviews. And so many complicated journeys to the front door of the medical practice. The other thing that we're seeing is shift in the results format. So if you've used Google recently, you've probably seen AI at work, because what we're seeing at the top of the funnel, general queries, we're seeing a lot of AI overview answers. So if somebody Googles, knee pain or tummy tuck, or a general medical query, very often we'll see this AI overview that pushes all of the other website results down the page. When somebody's doing more of a local search, say they're searching for orthopedist near me or dermatologist near me, we are still seeing more traditional search engine results pages. That would be the maps showing with the practice websites listed there, and then underneath the maps, the organic results. So it depends what kind of query is being put into the LLM or the AI.